Welcome to Academic Problem Solving Academy. Today I will be taking you guys through outbreak investigation, but first should start by defining what is an outbreak. According to Centers for Disease Control, an outbreak refers to a sudden increase in the number of disease cases among a specific population in a geographic area during a specific period of time. So as you can see, we have a curve there showing an outbreak. So actually an outbreak, it is in most of the cases an alert due to the following: surveillance, health facilities, maybe rumors, community reports via village healthcare workers, media reports, and etc. All this can be combined to alert an outbreak. An outbreak investigation. We should start by thinking, why should an outbreak be investigated? One can ask themselves. An outbreak can be investigated to identify the disease cause and the sources, determine the extent of the disease, identify appropriate control and prevention measures, as well as informing disease control programs. Those are the reasons that can lead to an outbreak investigation. But what is it? What is an outbreak investigation? It is a systematic process that needs to be approached holistically. I need you guys to understand this. It's a systematic process that needs to be approached holistically. And One Health approach is in most of the cases used in outbreak investigation. One Health approach is an approach that involves that incorporates the professionals from the following departments: environment, human and animal health. Now we will be delving into the steps of an outbreak investigation. The first step of an outbreak investigation involves the preparation to conduct field work. In this step, the team is formed, and this team sit down to agree on the plans of action. That is, what should be prepared. Logistics for lodging, the supplies, as well as obtaining authorization and approvals to conduct field work from the relevant authorities. Step 2. In this step, the existence of an outbreak is confirmed. In this step, the current cases, if they are compared with the past reported cases, and the use of rates is utilized to compare in order to prove that the cases are sporadic or clusters. Step 3 involves the verification of diagnosis. Actually, in this step, the aim is to correctly identify the cases of the disease by confirming the clinical manifestation, such as, or we can say, signs and symptoms of the disease, and also the laboratory tests can be carried out to obtain laboratory results in order to confirm that in order to verify diagnosis. Where possible, index cases are identified. So Going to step number 4. Step number 4 actually is actually the definition of a case, or we can say the counting of the number of cases. So the case definition here has to be defined, which also have to be time bound. A case definition gives a standard way of identifying the suspected, probable, and confirmed case. What is a suspected case? A suspected case, we say it is a case that shows clinical signs and symptoms which are compatible with the case definition of the disease but not backed by lab results. The probable case, we say that is a case that has a compatible signs and symptoms in the relevant epidemiological history. Also, lastly, the confirmed case, we say that it is a definitive case, one whose lab results confirm the presence of an infectious agent even without clinical manifestations or the clinical signs and symptoms. That is a confirmed case. So moving on to step number 5. So actually step number 5 is data analysis and generation of hypotheses. And in this step, descriptive statistics is utilized to describe the cases by person description, place description, and time description. In the context of time description, we can identify the population at risk and all those that are affected maybe by age, sex, occupation, immunization status, migration status, and etc. So place description attempts to locate the affected population by their geographic location. For example, those who live in the rural areas or those who live in tropical areas. For time description is done using epicurves. So where a plot of cases versus time is devised. So in most of the cases, you see that the shape of the epicurves gives clues about the disease and may also show the delay or quickly how delayed or quickly interventions were made by the authorities. Or yes. So going to step number 6. This step involves test and refine hypothesis with an analytical study. So based on the descriptive epidemiology from step 5, there should be a need to select an appropriate study design, such as maybe case control, cohort study design, or experimental study design. So the resources are obtained to conduct and analyze the study, and the conclusion is drawn from the study in order to generate and refine hypotheses. Case control, cohort study design, and we know that in most of the case control study designs are those when we have the cases and then we have the controls. We also have the cohort study design, and we also have the experimental study designs. The experimental study design, this can include the study designs like clinical trials. And we have step step number 7. This step involves the implementation of prevention and control strategies. So based on the disease, strategies to control the disease can be implemented, such as health education strategies, maybe implementation of decontamination of infested soils, and as well as development of vaccination campaigns. So going to step 8, step number 8 actually is the reporting and dissemination of findings. When the outbreak is being carried out, or after the outbreak has been carried out, there should be a need to communicate the findings, and the findings can be communicated with the authorities, and detailed as well as verbal reports can be developed and shared with the relevant stakeholders. Going to step 9. This step actually involve the risk assessment. We conduct a risk assessment to determine if the outbreak poses a potential public health emergency of concern, and the International Health Regulation decision instrument in Annex 2 is usually utilized, whereby we can answer, we can carry out a survey based on the following questions. Is the public health impact of the event serious? That will be the first question. Secondly will be, is the event usual or unexpected? So the answer can be yes or no. Is the event usual or unexpected, meaning has there ever been a case of that nature, or is it unexpected? So also there can be, is there a significant risk of international spread? Is the event, can the event cause the risk of international, can it spread internationally? Lastly, if it spreads internationally, can it poses a risk of international trade and travel? Can it hinder the issues of trade and travel? So if it is a yes, the decision instrument says that the actually the event then can be reported to WHO. So going to step number 10, it involves which is the last step, it involves maintain and intensify surveillance. So actually in this step, national level should maintain a consistent, or they should consistently report or update WHO on the daily, or updates, or we can say maybe the number of cases, the deaths, people admitted, those who are discharged, those who are affected. That is, there should be that timely reporting and daily updates that can be made always, so that WHO is always updated on what is going on in that affected area or region. And this is mostly done from the national focal point of that affected region. So thank you so much. I hope to see you all on our next videos. Thank you.